In this video, I'll review concepts from Chapter 22 of Human Anatomy and Physiology 11th edition. This chapter is focused on the respiratory system. In particular, we'll look at respiratory diseases including COPD, asthma, and lung cancer. First, let's look at COPD. This is chronic obstructive pulmonary disease, COPD. This is an irreversible decrease in the ability to force air out of the lungs. This includes chronic bronchitis, which is inflamed and fibrosed mucosa of small bronchi, leading to airway obstruction. So basically, the resistance of the airway gets greater and greater, and that's going to decrease the flow of air through the airway. So chronic bronchitis, and emphysema. So this is the permanent enlargement of alveoli, but importantly, this isn't just the alveoli getting bigger, it's the alveoli being destroyed. So the destruction of the alveolar walls and the replacement with scar tissue, and air is much less able to diffuse between the blood and the alveoli across these damaged alveolar walls. So that's emphysema. And just to point out, both of these, chronic bronchitis and emphysema, can both be part of COPD. So common features of COPD. A history of smoking is found in 80% of COPD patients. So tobacco smoke and air pollution are the two most common causes. There are also some genetic causes that can lead to a breakdown of lung tissue. A normal manifestation of COPD is something called dyspnea, and that's labored breathing. It's also known as air hunger. So someone can breathe and not get enough air. Coughing and frequent pulmonary infections that's common. And respiratory failure is the final manifestation. And this just means that you're not able to breathe enough to have normal CO2 and carbon dioxide and oxygen levels in your blood. Next, we'll look at asthma. This is actually a reversible decrease in the ability to force air out of the lungs. So another name for asthma has been reversible COPD. Remember, COPD is irreversible. So asthma is a reversible decrease in the ability to move air in and out of the lungs, and in particular out. It's characterized by coughing, dyspnea, wheezing, as well as chest tightness. Airway inflammation can cause asthma. It's an immune response, and those airways can become thickened with that inflammatory secretion, also called inflammatory exudate. And finally, looking at lung cancer, this is the leading cause of cancer deaths in North America, and 90% of lung cancer cases can be traced back to smoking. If there is no metastasis, meaning if no tumor has spread to a different part of the body from the lung, then surgery can be used to remove the diseased lung tissue. However, if the cancer has spread from the lung, then the patient is going to require radiation and chemotherapy.